Yeah.
All right, well, good morning, everyone. Thank you so much for joining us. We're really excited for our World Prematurity Day press conference. We are first going to start with, I'd like to welcome Dr. Larry Rand, who leads the UCSF California Preterm Birth Initiative and is a doctor that focuses on high-risk pregnancies. So, Dr. Rand.
Thank you, Chanel. Fantastic. Good morning, everyone. Welcome and thank you. We and I are so honored to be here with all of you to recognize the epidemic of prematurity and Prematurity Awareness Month. I'm deeply grateful to our esteemed San Francisco leadership for really bringing this issue to light and for, and I'm speaking on behalf of the mothers and the members of our communities and our UCSF researchers, our partners at the Department of Health, and of course many other committed partners that are working collaboratively on this effort, so thank you. People are often shocked when we share that prematurity is the leading cause of death in children under the age of 5 worldwide. We usually think of dehydration, malnutrition, but not necessarily prematurity. And the numbers are truly staggering. 15 million babies each year born prematurely around the world. Hard to wrap your mind around that, each year. And 1 million of those, unfortunately, lose their lives. But the 14 million who survive are at significant risk of complications throughout their life, both cognitive and physical. And really, it affects everything from the ability to get an education and your earning potential, and the cycle, as you can imagine, repeats. So, I have the privilege and the challenge of leading this California Preterm Birth Initiative at UCSF. And it is a groundbreaking initiative that was made possible by the truly visionary gift of two really wonderful people, Mark and Lynn Benioff, who are friends to the city and very committed to the cause. And it's important that we're working in California in particular because 1 in 8 births in the United States every year occur in the state of California. So what happens in California and our ability to hopefully successfully turn the curve will have impact and be very much noticed around the nation and certainly around the globe. And for years, the preterm birth rate in California has been 10%, 1 in 10 babies born too soon, and it has unfortunately not changed in decades. And sadly, the last 2 years we've actually seen a rise in the preterm birth rates. So what's going on? Through the work of the initiative, we've been able to really dig into the data, and we have some very powerful state data resources, and created heat maps to try to help us understand what's going on. And what's very clear, crystal clear in fact, is that preterm birth does not affect everybody equally. Prematurity disproportionately affects women who are low income, women of color, and it has a profound impact on California's most vulnerable and chronically stressed families and communities that they live in. And as we know, women really are the core of communities and growth around the world. So I have to say, frankly, Black babies are dying in our community at 2 to 3 times the rate of white babies. And that's in a city with the same resources, the same cutting edge technology and medical capability that's supposedly available for all. How can that be? If nothing else, how do we close that gap? Preterm birth epitomizes that health inequity. And that's a systemic issue, which we all know is a very difficult thing to move the needle on. So I will say that, frankly, previous research hasn't moved the needle because, like everything else, medical research is very siloed, and the research that's taken place in prematurity has always been isolated to the health sector, and importantly, never includes the voices of the women who are affected by preterm birth, who are the real experts, and whose voices need to be at the table. And, you know, frankly, not everything is a pill. And it may be obvious, but it's easy to forget that people's health and therefore pregnancy outcomes are affected by how they live and where they live. That's the environment they live in and what they're exposed to, the food and shelter that they have access to, how and where they work, and the access to care, and most importantly, the trust that they have in that care. And of course, the organizations and institutions that govern the policies to make all of that infrastructure possible. So that's why the California Preterm Birth Initiative at UCSF is changing the way that we are approaching this research. And we're coming at this epidemic using the same powerful model through which this city made history, historic progress on HIV/AIDS. And that was something no one thought was possible. So finally, I just want to remind us why this is so urgent, because we're talking about the beginning of life, the building blocks, the foundation on which everything else is built. And without that, it's really difficult to succeed. A healthy pregnancy and a healthy birth equates to a healthy start to life, and every child deserves an equal chance at a healthy start. So we're standing here aligned, arm in arm, prioritizing the health of mothers and babies and children in California. And I have to say, this represents the very best of San Francisco's heart and mind and ability to lead. So let's make history again and do this. So thank you so much.
I'd like to welcome Senator Scott Wiener, California Senate District 11.
Thank you, Chanel. First of all, I want to just take a moment to thank UCSF for once again leading. We sometimes take UCSF a little bit for granted in San Francisco. We're so used to having this institution here that we don't always step back and realize how lucky we are. Not every city has a UCSF that not only provides extraordinary health care to so many people, but is on the cutting edge of so many important issues around health and well-being. It seems like every few weeks I'm working on a different issue where, lo and behold, UCSF is on the cutting edge of moving us in a positive direction. So thank you to everyone at this great institution. You know, children have so many challenges in this state. Something like half of kids are living in poverty or close to it in the state of California. Kids who are struggling with housing, with education, with access to food, with so many different needs. And it's an uphill battle for too many kids in this state. And we're going to address that. We're working so hard to try to lift these kids out of poverty, but we should at least give them a shot to start out healthy. And when you start out your life with sometimes severe health problems, you just make it harder for those kids to achieve and to confront all the other challenges that they have. And so anything we can do to get these kids healthy from day one and before day one, we need to do. We also just need to call it the elephant in the room, and that is there's an effort in this country right now to take a wrecking ball to access to health care. And for reasons that I will never understand, I've been in politics for a long time, I have seen many political battles. I do not understand the obsession with trying to kick tens of millions of people off health care. The obsession with destroying the Affordable Care Act, the obsession with making massive cuts to Medicaid, so that the 1 in 3 Californians, 1 in 2 children in California who were on Medi-Cal will lose access to at least some health care. I don't understand it, but that's the reality that we face. But this is yet another example of why it's so important to win the fight for access to health care. When mothers, expectant mothers, are able to have great care during their pregnancy, are able to be healthy and give birth to a healthy child, it makes it better for everyone. And that family's gonna be better off, the community's gonna be better off, the kid is gonna be better off. So let's keep working for universal health care access. Thank you.
I'd like to welcome Assemblymember David Chiu, Assembly District 17.
Thank you, Chanel, and I appreciate the cry of the next generation in the green. I also want to start with a great thanks. It's wonderful to be here with my former colleague, my past colleagues, our community members who have been leading this effort, but in particular to UCSF, to our researchers and our practitioners. You guys are really a guiding light in sharing with us and partnering with policymakers to do what needs to be done. This is a topic that is very personal for me because before my son was born 20 months ago, my wife and I, like all new parents, we thought and worried about what might happen if our son came early. And the fact of the matter is, we were fortunate. I happen to be a neighbor of Malia Cohen's. I live in District 10, I live in the Bayview. And we know in the Bayview that women are 3 times more likely to experience preterm births compared to many other places in San Francisco. And that is unacceptable, and that is why we are here. The fact of the matter is, we are one of the wealthiest cities in our state. We're one of the wealthiest states in our country. We're the wealthiest country in the world. And yet, we have seen preterm births increase from last year to this year. And we've not been able to get these numbers down. And so the fact of the matter is, for us to come together as community, as government, as the education sector, as our research sector, to say enough is enough, we need to stand together and work and do the hard work that's necessary to get these numbers down. That's something I'm fully committed to. I'd actually thought about bringing my son today, but thought he would be chirping a little bit too much during the presentation. But at the end of the day, we're doing it for him, and ma'am, for your child, and for the cutest kids who are here in this room, because we know that if we don't work on this today, not only are we not assuming who the next PhD researchers are going to be at UCSF, but it's going to cost us more as a society when it comes to our education expenses, when it comes to our social service system, when it comes to all of the things that we need to and want to do in our community. So I'm dedicated, and I look forward to working with all of you to getting these numbers done. And hopefully someday we won't have to have press conferences like this, because the numbers will be where they need to be. Thank you very much.
Thank you. I'd like to welcome Mike Anderson, President of UCSF Benioff Children's Hospitals.
Good morning, everybody.
Good morning.
Good morning. It's an honor to be with you today. I too want to say thank you, maybe in a little different way. I want to say thank you on behalf of the physicians and the nurses, the researchers, the advocates, the therapists at UCSF Benioff Children's Hospitals, but most importantly on behalf of our patients and our families. Thank you so much for focusing on this work. At UCSF Benioff Children's Hospitals, we really focus on 3 things: healthy children, healthy communities, and a healthy world. Healthy children. We need beautiful, thriving, gorgeous children like this, and we bring some of the most incredible pediatricians and advocates to care for these kids each and every day. We have an intensive care nursery that is literally the leader in the nation. But I can think of no part of my hospital I would like to put out of business tomorrow than the intensive care nursery. Because as Larry pointed out, we still have too many children born prematurely. They get great care, they get great service, but as Larry also points out, not all of them survive, and many of them have incredibly horrible effects of being born prematurely. So healthy children is our focus, but obviously we need you. Healthy communities. As you can see from the group up here, it really takes a village to get this work done. It takes physicians and researchers and advocates and government. If we're going to push the envelope It really does take a village and take a community. A couple of us up here have a little bit of trouble hearing today. We were at the concert last night, Dream Fest for UCSF Benioff Children's Hospitals. There's no better example of how this community can rise to the occasion than that concert. 42,000 people said, yeah, I'd love to see a great show, but by the way, I'm gonna help your efforts. And the wonderful work that Lynn and Mark Benioff do each and every day is a testament to the power of the Bay. And then finally, a healthy world. We are a leader in the nation. We bring incredible vigor to research, to curing diseases I never thought we'd cure. But all that great stuff doesn't mean anything if we don't have equity and we don't have access. And that's what this initiative is all about. I'm very proud. You may have seen in the press recently, we started a big campaign to build the next generation of UCSF. And a big part of that is partnerships to improve equity. It's not just a slogan, it's not just some catchphrase, it's truly part of who UCSF is. So we think about healthy children, healthy communities, and a healthy world. And I'm so honored to be a part of this work. Thank you very much.
I'd like to welcome London Breed, President of the San Francisco Board of Supervisors.
Thank you. Thank you, Chanel. You know, it's interesting that when you look at the data and how African American women in particular are impacted based on the studies, and you see that the premature births in the African American community are higher than any other community. I will tell you from experience of growing up in the African American community in the Western Addition, I'm not surprised by that. Getting prenatal care was not something that happened for many of the women who were pregnant in my community. In fact, before I became a member of the Board of Supervisors, when I was the executive director of the African American Art and Culture Complex, we had some young people who got pregnant and they were not getting prenatal care. I remember having a conversation with one young lady in particular and just almost an argument as to why she would not seek out prenatal care. And also I proceeded to help her fill out the forms to apply for Medi-Cal and to get the appropriate support she needed. She was already 6 months pregnant. And so when we think about it, the fact that it's normal, even in this day and age, for many of the women of the African American community to not seek out prenatal care is scary. And so I applaud UCSF for having the foresight to look at the data and to look at solutions and to fund this incredible program that is going to really target the communities that we know need this support the most. I'm excited about the hospital that's going to be made available, the research, the support, all of the things that are necessary in order to make sure that we do exactly as Dr. Rand has said, roll back the clock and make gains around this particular issue, similarly to how we have made incredible gains around the AIDS crisis back in the 1980s. So we can look back in the next 10 years and think, wow, this initiative helped start something that has changed those numbers, that have changed the data. We know that there are so many stressors that have an impact on communities that are low income, whether it's the violence, whether it's the crime, the lack of job opportunities, the hopelessness, the despair. I lived in this environment and I watched as my entire community was destroyed all around me. And so I think it's important that we shine a light on the issues that impact our health the most. This is the very beginning of that stage, and this is what's going to make the difference. And so from my perspective, this is definitely an important part of the beginning of life and how we change the tide and how we make sure that the next generation of young people grow and thrive and are healthy from day one. And someone who has been an incredible advocate, making sure that after our children are born, that some of the issues around health, including the soda tax and banning tobacco and all of the things that get into our kids' lives and creating that once they are here, who's been fighting and focusing on health of our communities. I want to introduce to you all my colleague, Supervisor Malia Cohen.
Good afternoon, ladies and gentlemen. It's a pleasure to be here and to celebrate this initiative. I think that it is no mistake that you have the two black women cleaning up the program at the bottom, right? Holding it down. And so there's a couple things that I do want to communicate. First of all, without the thought and leadership of the premier research institution supporting us, none of this work would be relevant. No, excuse me, none of this work would be well received. I believe that particularly African American and Latino babies have been dying at a disproportionate rate. And when it comes to looking at the health statistics in the city, these are the two communities that are always at the bottom. Now, it is a fact that both London and I have the best health care, we've got advanced degrees, and yet we still are at a high risk of not carrying a baby full term. And that is a problem when you have a city that has a $10 billion budget, when you're part of a state that is the 6th largest economy in the world. Just to put that out there, that should not be an issue. I came to this work as a member 7 years ago, representing the southeast neighborhoods of Bayview, Hunters Point, Preterm Hill, and Visitation Valley. And there was an interesting article that ran in the Chronicle about 8 years ago that talked about the health disparities, the likelihood that a black man would not live as long as someone who lived in Nob Hill. And unfortunately, that statistic still remains the same 8 years later. I became familiar with preterm birth, low birth rates through the Black Infant Health Project, which is home in District 10 in the Fillmore. And as I began to familiarize myself with a lot of the issues, I've been trying to figure out what exactly are the outcomes that we can see immediately. So I'm chair of the budget committee, and so my priorities have always been to fund organizations, to support organizations, to ensure that we are fully funding these health initiatives so that they begin to turn around the outcomes, so that young children, before they're even born, have a real fighting chance. Now, we have also been instrumental in changing the systems outside in the world, like the police reform. That has a direct relationship on the health and well-being of a child. Making sure that we've got the Southeast Health Clinic, the health clinics are fully funded. Making sure that there are partnerships with research institutions that are not just researching and researching dominant cultures, but also researching African American women in particular, and Latino women, because statistically speaking, NIH and other research institutions that have research dollars do not pour into money into the black community. So the problem here is very systemic. It's much larger than the initiative that we have here. The initiative is calling out one particular element that touches each and every one of our lives. We have a responsibility. We must run for office. You must seek appointment to the Health Commission. These are all different policy-making bodies that have an effect on the outcomes of our daily lives. And so I really hope that my words would inspire the young future generations and the women that are in this room to really take a hold of your future. Till this day, we are still fighting the right to carry a baby or to not to carry a baby. What is our best family planning? Crisis pregnancy centers are still a problem. Type 2 diabetes, I mean, we've got real healthcare challenges. And so I don't come to bring doom and gloom. Actually, I do have a message of hope. There is a message of hope in all of this, but we do have to roll up our sleeves and stop denying the data and pay attention and get to work. Thank you.
Supervisor Cohen. I'd like to welcome Curtis Chan, Maternal Child Adolescent Health Medical Director for the San Francisco Department of Public Health. Thank you.
So, all right. The families in San Francisco are so grateful for the leadership of the city and also for UCSF to address the social and racial disparities in preterm birth rates in San Francisco and throughout California. We are so grateful that you're standing here together to highlight those inequities and the structural policies and systems that actually determine those disparities. So as all of you highlighted today, the duration of pregnancy is the indicator of how society cares for girls, how society cares for young women, and how our society cares for mothers. And her living conditions here in San Francisco are not just determined by what we're doing here currently, but the long history of segregation, unfair federal and state policies that are brought forth by racial issues and bias. And these issues and bias allow the unequal opportunities and social conditions where our girls, our young women, our mothers, where they learn, work, play, and receive health care. That toxic stress that you all spoke about today so eloquently accumulates throughout a girl's childhood, throughout her life course, and directly impacts her reproductive health and the actual womb that carries our babies and our next generation. So once again, thank you for a great leadership here in San Francisco, at our universities, and at the state, for representing San Francisco, for your renewed commitment to reverse these inequities that are prevalent throughout the country, but we can address here in San Francisco together, because we can create these healthy communities and healthy babies together. So thank you so much.
And our final speaker, I'd like to welcome Brianna Taylor. She's a Benioff Community Innovator with the California Preterm Birth Initiative.
Once again, my name is Brianna Taylor, and I am of the demographic that is most affected by this epidemic. Because of my experiences working with the community, I was invited to join the UCSF California Preterm Birth Initiative and become one of 13 Benioff Community Innovators. Our charge was to learn from women in insecure housing situations about their experiences navigating housing while pregnant. I deeply care about this issue because I am stressed out by incompetent medical care. Hearing from women about their experiences navigating housing while pregnant, I was floored by the level of neglect these women received, be it from landlords, medical personnel, or providers of desperately needed programs. I was heartbroken when I heard that in order to receive a bed in a homeless shelter, many hid their pregnancy. I cried with them when I was told that they were rendered homeless because they no longer counted as a single person, but could not yet classify as a family. I was dumbfounded when I heard that they were evicted or couldn't find housing because landlords didn't want kids in their properties. What I have found most compelling about these women's stories is the stress that comes from trying to simply survive. This has to change. Together we need to look at preterm birth as a community issue with community solutions rather than as an issue women must face alone, and help people get the access to care, shelter, and food they need so that babies are born healthy. This is especially close to my heart because of my own experiences. When my daughter was born 5 years ago, I lived in public housing in San Francisco after moving from Michigan and felt this stress firsthand. In San Francisco, I've experienced environmental health issues that I have never had before, and I see those exacerbated in my child. I see those throughout our community, like her asthma. I don't want her to have to feel the stress of our community that comes from living in inadequate housing. I don't want to just see her thrive, I want to see her survive. I am an advocate for a better quality of life, and that begins with pregnancy.
Yes. Well, thank you so much to all of our speakers and to everyone that's joined us here today. If anyone would like to ask us questions, we'll be around after to answer anyone's questions who is here from the press. So thank you so much for joining us. Thank you.
Thank you.